We're back with Mary Lloyd talking about how women can better prepare for physical changes tied to surgery, recovery, or hormonal shifts. From compression garments to lymphatic care, there's a lot women aren't being told. So, Mary, do you think there's enough public awareness, even in healthcare, about the importance of appropriate garments for recovery?
For recovery, no, there's absolutely
Mm,
not a lot of help out there. During the pandemic, there were several hundreds of thousands of cases that were going undetected. So now, when women are into the system for having their mammograms and they're getting caught up, they're finding more and more breast cancer. So, what's happening is a lot of the processes are hurrying along to get you from diagnosis through to surgery, and a
mm.
woman is not given maybe the best literature to read or not encouraged to reach out to find those specialists. There are opportunities out there to learn, but they're not directed as to where to get that information. It's just a matter of you have to have surgery.
So,
And for many women, sorry to interrupt you, for
no,
many
no
women,
worries.
hearing that word cancer puts their mind in a total different world.
Absolutely.
They're they're now in, who's going to look after my kids? Who's going
Hmm.
to make dinner? Who's going to do the laundry? I have to tell my work, and I'm going to be off for a while. I don't even know how long I'm going to be off. There's so many things that go through a woman's mind in that diagnosis and that word that really they're not ready for information that
Mm.
day. They need information follow up.
So, what should women know ahead of surgery?
They should know that, first of all, they're in the bra fitting world, they're in the driver's seat.
Okay.
I'm not about asking a woman to accept high cost products. I'm there to talk about what it is that they are having done, when it will be happening, and what it is that we can do to create less of discomfort, what the recovery might be like. You know, it might take up to 6 weeks before they can go for their first official full fitting after the
Mm.
surgery. Some women aren't told that. That whole situation with drainage tubes, where women, after having a breast removed, have a tube and pouch attached to their abdomen. We have products that you can go out of the emergency room wearing a camisole that has pockets in it that drainage pouch goes in.
I mean, that's
So, I mean,
really
there's great
thinking.
stuff.
That's wonderful. I would never think of it like
Mhm.
obviously I haven't thankfully had to need that. But really being proactive and thinking about that, and those are such crucial things for comfort and feeling like you're able to handle the recovery process in a comfortable way.
Certainly, because the last thing you want is a woman to have an allergic reaction to, like, medical tape, for example, on their
Right.
abdomen. They've got enough to recover with. They don't need to have that on top of it.
No.
So that's a really important garment for women to have coming home from the hospital.
So what can you offer then like this during the waiting period between diagnosis and treatment? And what about post surgery?
So, when a woman comes into the office and it's pre-surgery, I like to sit down with them, hear their story, because that's very important. We're going to build a relationship of trust. Women are generally here 30 to 45 minutes. I give them some information literature. I show them different products, and we talk about what it is that is ahead of them, and are they interested in having some of these garments? Because again, it's not about the sale, it's about a woman who's going through a really difficult time in her
Right.
life, and she needs a friend out there that she feels comfortable telling her story to, and
Hmm.
and getting the support.
Yeah, I love that. Most people would think of a woman's garments, wouldn't assume how connected this is to really personal, emotional topics. How do you see your work supporting women's dignity and care?
I think for the dignity, it's so important when we get to the post-surgical and they're about to start wearing a prosthesis, which is a difficult name for a woman to think of for a breast.
Hmm.
It's important for them to feel comfortable and to know that that I'm certified and trained, that I'm not going to say this is the one for you and only the one you can wear, but to offer those different kinds of, whether it's entry level soft puffs in their bra or it's a full on prosthetic, Again, you're in the driver's seat, and we want to talk about your lifestyle and what will fit your life the best.
Okay, when we return, how to advocate for yourself and embrace your undergarments as an act of self care, not vanity. Stay with us.